Hi, I'm Dr. Justin Bryant, a Airrosti certified provider out here in Virginia. I'm here today to talk to you about neck pain. We're going to talk about what causes neck pain, how can neck pain present, then we're going to talk about traditional medicine, their approach to treating this condition, then we're going to talk about Airrosti and how we're a little bit different. Let's get started. What we're going to do is we're going to talk about what can cause neck pain and how neck pain can present. Because the neck contains multiple groups of muscles, tendons, and ligaments that attach to the head, that attach to the shoulder, that attach to the back, you can have a wide array of causes of neck pain. Some of those causes can be poor posture, stress, injury, or a combination of all three. I don't know if you knew this, but you have a double your chance of neck pain if you sit at a desk all day. And that the American Pain Foundation concluded that neck pain is the third most common pain that Americans will feel, and 70% of Americans will experience neck pain at some point in their life. Now, how can neck pain present? Neck pain can present with pain in your neck, pain in your shoulders, pain in your back. You can have pain that radiates down your upper extremity. You can even experience headaches that are from neck pain. You can have muscle spasms, you can have tightness, you can have decreased range of motion. Maybe you can feel some weakness in your shoulders, in your neck, in your back. So now that we know some of the things that can cause neck pain, let's talk about how is traditional medicine gonna approach treating neck pain. They're gonna prescribe to you rest, ice, anti-inflammatory medications, maybe some injections. They may opt to use some expensive imaging like x-rays or MRIs that may or may not show you what's going on. They may prematurely recommend a surgery. Now, all of these options can be effective, but sometimes they're not. Which leads us to, how does Airrosti differ? Here at Airrosti, we get 60 minutes with you every single time you come in. This allows us to go through a thorough examination and really determine what the underlying causes of the pain that you're dealing with is. As we talked about previously, neck pain contains a lot of different moving parts, so we got to figure out what is actually causing the pain. Once we do, then we're going to do very specific, focused manual therapy to treat the pain and maybe the decreased range of motion, the tightness that you're feeling. That's the first 30 minutes. The second 30 minutes is where we're going to do very specific active care for you and your case to treat the underlying cause of those aches and pains so that you can get your long-term resolution. Because here at Airrosti, we want to fix your pain as fast as possible and get you back to doing the things that you love to do. Thanks for hanging out with us as we talked about neck pain today. If you're dealing with any of these signs and symptoms, please find your closest Airrosti provider. Let us take this pain away from you as fast as possible. Thanks for hanging out. See you on the next video.